How's it going? It's Matt with Mobility 101, and right now we're going to go over some additions you can add to your pre-training warm-up routine. Just some soft tissue stuff first. So number one's going to be using the foam roller, so soft tissue. We're going to look at aiming at getting the Quadratus Lumborum. So that's the muscle on either side of the spine right over here. It attaches roughly on the spine T12, T11, T10, all the way down to the pelvis. So why that's important is because it's on both sides of the spine coming down into your hips or your pelvis bones. And ideally that muscle is kind of anchored down, it's tight, it's very taut, it's always predominantly knotted up. So to loosen that up very gently and softly is quite important, specifically if we're going to be using our lower back for movements during exercise. So number one's going to be, you want to foam roll the QL on either side. So you got to pin it first. So once you have it pinned down, aim on that side gently. Use your feet to help prop. Now, and also use your shoulder as if you're in a side plank to help prop up as well. And it's going to be very gentle back and forth. If this setup is not enough, not aggressive enough, simply pick one leg up and then you can kind of get at it a little bit more intenser, okay? I like to hit 8 to 10 rolls per side on both sides. Number two is going to be, we're going to roll the glutes. So think about glutes, hip rotators, the muscles that help our hips rotate externally. I think those help a ton, especially with loosening up the lower back and kind of getting your backside, your posterior chain muscles to activate and fight quicker and more efficiently. So we're aiming for this area right here. I'm going to kind of, again, pin it down, use my other arm to stabilize. And again, this may be enough right here, okay? But if you want a little more, you can kind of pick that leg up again and just roll. You get a little bit deeper there, and again, 8 to 10 rolls per side should do the trick. So that's going to be the soft tissue additions to your routine. Now we'll go on to mobility drills to add. So number one's going to be, we're going to aim for that posterior hip capsule. So all the way up in the hip, right in the capsule in the socket, ball and socket joint. So we're going to go over a drill where you can kind of mobilize that tissue, the surrounding musculature of the hip. So what I'm going to do is I'm going to hike my right foot forward, try to keep my toe down, my knee down, okay? Try to create like a nice little anchor right here, okay? It's going to be perpendicular to the other leg. So I'm going to take that other leg, lay that back knee as almost like a hammer, and this is going to be the nail. I'm going to hammer that knee into the nail. And again, now I'm going to sit into my right hip. So the leg that's forward and perpendicular to the back leg is the hip we're sitting into. So I'm going to sit into it, come out. I'm using my hands a lot here to stabilize and hold myself up. And again, try to aim for 8 to 10, mobilizations per side. That seems to do the trick. I'll show you on the other side as well. Hike that leg forward, take that back knee as the nail, the hammer into the nail, sit into that hip. Okay, there you go. Now, lastly, the second mobility drill to add is going to be quad hip flexor mobilization. It's a little different than you've seen in some previous videos and that you'll see in the field. It's more of you're using your hand to add just a little bit of traction, a little additive in the stretch. So set up your hands almost as if you're in kindergarten or elementary school playing paper football on the desks. This would be the field goal post. Okay. So set up your field goal post behind your front knee. Okay. Make sure that back toe is in the ground. Squeeze that back side. Notice how from my head to my knee stays a straight line. So my head to my right knee is going to be a straight line when I go forward. I'm not going to be excessively arching, okay? So back toe stays in, squeeze my butt, applying pressure this way into the back of my knee. Gently lean forward and come back. Lean forward and come back. So if my left leg is forward, I'm mobilizing my right anterior aspect of the hip, quad hip flexor, and all those good muscles. Again, 8 to 10 times per side, then I would switch. I think you'll be able to see it better on this side. So again, head to knee is a straight line, it's flush. Back toes in, squeeze that back glute. Gently apply pressure forward, behind my knee with my fingers. And coming forward, squeeze my butt and back. Squeeze my butt, and then coming back. Pushing forward, squeeze my butt, and then coming back. Give that a shot, 8 to 10 times per side. Let me know how it feels. Thanks.